What does someone need to do to experience bruxism? Do they need hyperactive lateral pterygoids so their jaw waves side to side or forward and back? If there's no elevation happening, who cares about hyperactive lateral pterygoids? It's just silly. So we've got a little bit of side to side and hardly any elevation. Let's add a little bit of elevation to this lateral pterygoids that are not doing anything anyway. If you have a little bit of elevation just so the teeth can be approximated somewhat, you've got grinding of the teeth. There's the person who doesn't even have, they didn't feel bad. Wow, look at your teeth. Don't you feel awful? No, what are you talking about? If you increase the elevation still further, the lateral pterygoid now has more resistance in its attempt to move this mandible. Sometimes you'll get force vectors going, and sometimes the position of the occluding scheme creates force vectors that damage the joint, or crush the tooth in its socket, or shear off a cusp, or strain the muscle, so you get muscle aches and headache and jaw. Excursive clenching, I think, is part of bruxism. Let's just have them elevate their teeth, their jaw as intensely as they can. I don't care what the lateral pterygoid does, that jaw's not going anywhere. I call that primary clenching. Clench like nobody's business, and you know what? The teeth look fabulous. There is no dental wear in a primary clencher, and their jaw joints are both stable because they have posterior support for the joint on both sides. Those immobilized joints, that person can be ridiculously miserable with headache and migraine. To me, the definition of bruxism is jaw clenching, with or without forcible excursive movement. I don't think grinding, I think clenching. The intensity of the clenching will dictate the severity of the signs and symptoms. If you have minor, minimal clenching, it's not going to be a problem. So these things present kind of uniquely, but they blend into each other. Grinding can be asymptomatic, super common in the population. There's considerable tooth wear, and there's a high demand for low-cost therapy. The Doctor's Night Guard, or whatever it is at Rite Aid Pharmacy, there's a whole bunch of that things in there now. Excursive clenching, you could have some pretty interesting complex symptoms, the TMJ disorder patients. It's moderately common in the general population. Unusual tooth wear patterns, really weird, you have to look for them sometimes. And there's a cautious demand for moderate therapy. Every time I see that, I remember my wife was my first NTI patient. I didn't know she was going to be my NTI patient, but as a new patient, her jaw was aching. She had these headaches. She goes, yeah, my physician says I should probably see a TMJ guy, but I know you guys are just in it for the money. The TMJ industry didn't have a very good reputation. There's cautious demand. You better watch out. It might not work for you. It might backfire. Why? I don't think we understand what's going on, how it got that way or how it stays that way. In clenching, they could be severely symptomatic. It's highly common in the population. There's unremarkable tooth wear patterns. There's a high demand for effective treatment. But we don't even know what's out there. Teeth look fine, raging headaches, jaw joints are fine. Why would we even know this is a patient that we can help? They're over in the neurology clinic. Oh God, raging headache, blah, blah, blah. Go like this. Does your jaw click? Did your jaw click? Do you grind your teeth? Oh, don't go see my TMD guy. That's what the neurologist would say. Our diagnosis, our treatment is diagnostically driven. Each one of these patients can be treated differently or should be.